FaceRehab. Podcast series.
Welcome to FaceRehab, the Facial Palsy Road to Recovery. I'm your host, Veronica, and I'm excited to introduce our guest, Trina Neville. Trina is a highly experienced physiotherapist specializing in facial palsy, bringing over 2 decades of expertise to her practice. She operates within the Specialised Facial Palsy Clinic at Queen Victoria Hospital and serves as the chair of a Facial Therapy Specialist International, contributing as a member of the Medical Advisory Board of a Facial Palsy UK. In addition to her clinical work, she leads support groups, providing invaluable guidance and support to those affected by facial palsy. In today's episode, we explore the synkinetic stage of facial palsy, characterized by abnormal involuntary movements during facial expressions, where unintended muscles are activated simultaneously. Join us for an in-depth discussions on crucial guidelines, effective techniques, and expert advice to successfully navigate rehabilitation process during this phase. If you would like to learn more about previous facial palsy stages, check out previous episodes of this podcast.
Facial Palsy. Road to Recovery.
Welcome once again, Trina. We are delighted to have you return to the podcast, sharing your important knowledge about facial palsy, especially focusing on synkinesis.
Thanks so much for having me back, Veronica. I'm really pleased to be here and to have this opportunity to share my knowledge on synkinesis, and particularly the things people can do to help themselves, either to prevent development of severe synkinesis or to improve synkinesis if they do have it. So, great opportunity.
Some of our listeners might not be familiar with the term synkinesis or what it means. Can you please explain what it means to have synkinesis or to be in synkinetic stage during facial palsy?
Absolutely. So the term synkinesis is one that patients struggle with because it's quite a complicated word and quite complicated to understand. So if we just translate it literally, it means combined movement, basically. So what patients who have synkinesis will experience is when they try to move one part of their face, the other parts of their face move at the same time, even though they're not trying to move those parts. So let's give a few examples. It might be that someone's trying to raise their eyebrows up, but as they try and raise their eyebrows, their cheek tightens and raises up at the same time, or their neck tightens at the same time, or both. It might be that they try to close their eyes gently, but at the same time, their cheek gets really tight and tries to lift up, and their neck gets tight as well, and maybe their eyebrow lifts up a bit. One of the most typical patterns of synkinesis we see is that when people are trying to eat or speak or drink, so they're using their mouth, but their eye starts to get involved in the movement. So their eye narrows or tightens or even closes completely when they're doing things with their mouth. So they might be chewing and it's almost like their eye is opening and closing in time with their chewing. So those would be some typical synkinetic patterns that we would see caused by movement happening in all the muscles or some of the muscles of the face at once, and that's what we call synkinesis.
Does every patient inevitably progress to the synkinetic stage once they begin regaining facial movement, considering that this stage is the final phase among the 3 stages of facial palsy?
That's a great question, Veronica, because no, absolutely not. Patients, once they find out about synkinesis, it's often their biggest fear that they're going to develop it. But actually, if people make an early and fast recovery, then they won't necessarily develop synkinesis at all. Synkinesis is caused partly by the nerve having to regrow along its pathways. So it's only patients who have a more severe nerve injury and a more delayed recovery that are likely to develop synkinesis in the longer term. So we usually find the longer patients have flaccid paralysis and then paresis for, the more likely they are to develop synkinesis. And again, not everyone will develop the same severity of synkinesis. So you can have 2 patients that both have flaccid paralysis for 3 to 4 months, both go on to develop synkinesis, but one might develop very severe synkinesis and one might develop milder synkinesis. And we'll talk further about what factors might affect this later. So no, not everyone will develop synkinesis. The patients who recover faster are less likely to develop it. And that for those patients who do go on to develop synkinesis, we won't necessarily know how mild or how severe that synkinesis will be and until we see how they're presenting.
Can you provide us with a deeper understanding of the factors that lead to synkinesis? Especially, what are the underlying causes and triggers that results in synkinesis?
So this is really interesting, Veronica, and I actually like to split synkinesis into 2 different types. I talk about true synkinesis and I talk about pseudo-synkinesis. So let me break those down a little bit further for you. So true synkinesis is caused by it's believed to be caused by the fact that when you have a facial palsy, the nerve is damaged or squashed from compression or cut and then repaired, stitched back together, for example. And then the nerve, once that compression has gone down, the swelling's gone down that's affected the nerve, or once the nerve has been stitched back together and then has a chance to heal and regrow, the nerve will grow down the pathways. So each nerve has like an outer covering which helps it to send the signals from the brain down the nerve to the muscles. Now, it's believed that sometimes when the nerves are regrowing, that they might take the wrong pathways. So, for example, a nerve that would have previously taken the message from your brain down the pathway to your mouth saying, say the letter B or P, that part of that nerve might now be going up to the eye. So when you say the letter B or P, not only is the mouth working, but now a bit of the eye is working as well, because that message from the brain is going to 2 places at once. So that's one of the causes of synkinesis, is the nerve actually regrowing to the incorrect part of the face. But we also know that when patients have facial palsy, the brain goes into a panic mode because the face is paralyzed. So I like to explain it to patients. I say, well, imagine you're the pilot of an aeroplane and you're flying towards the mountains and you need to pull up to get the aeroplane's nose to lift up to go over the mountains. So that's how I imagine the panic in the brain when the face is paralyzed. The brain is desperately sending signals down the nerve saying, pull up to the facial muscles. But because the nerve is damaged, the messages just aren't getting there. So the face can't pull up. So the brain is in this panic mode and continues to be in panic mode even as the face recovers. So it's this idea that the brain almost forgets how to relax the face, forgets how to use the face gently and normally and effortlessly as it would have done before, and instead tries to kind of send these strong, powerful signals to the face saying, pull up. And that continues even as people recover from their facial palsy. So they overwork the face, and that can become a bit of a habit, and they forget how to relax their face, which can also become a habit. So that can result in this excessive amount of effort. And when we use our face effortfully, when we put a lot of effort into our movements, we get what we call facial co-contractions naturally. So if you try to do a big cheesy smile, you'll actually find that you squeeze your eyes a bit. And if you try to over-exaggerate your movements, it will actually bring in other parts of your face to move with the part of your face you're moving. So we know that an excessive amount of effort will cause facial co-contraction. That's not true synkinesis, but it can look like synkinesis. So I refer to that as pseudo-synkinesis. So there's these 2 factors that can lead to a presentation that looks like synkinesis. There's the regrowth of the nerves to the incorrect muscles, and then there's this overuse, over effort of the face subconsciously that can look like synkinesis as well.
Is there a way to prevent the development of synkinesis? Are there specific measures that patients can take to avoid it?
Well, I would say there are some things that people can do to reduce the development of pseudo-synkinesis. And there is some research around techniques that might, again, reduce the development of true synkinesis. So if we look to the research, we can see that there's been research done to show that mechanical stimulation, or we would call that massage, of the face can improve motor plate reinnervation with reduction of polyinnervation, and that's the medical term for synkinesis. So they're suggesting that if people do facial massage, that will encourage the nerves to recover to the correct motor end plate, so the correct parts of the muscle, rather than recovering to multiple parts of the muscle. However, as I said, it depends on the severity of the injury to the facial nerve. Right back when people had their virus or their fracture of their skull or their surgery, whatever it was that caused the pressure on that nerve, whether it was swelling, perhaps the nerve was stretched in a surgery, perhaps the nerve was cut and had to be repaired. So depending on how severe that injury has been, will have an impact on how much synkinesis that patient is likely to get. So generally, if people have had a slow recovery, if they've had a nerve repair, it's inevitable that they will get some amount of synkinesis. And it's just difficult to predict how bad that will be. So in order to avoid it, as we said, we can do that. We can encourage people to do the massage, but we can also try to prevent what I previously referred to as pseudo-synkinesis. So educating patients about the damage that overusing your face in the early days or trying to force your face to move, that can actually do damage later on, because it can look like synkinesis. Actually, you're just training your face to work far too hard. And that's not beneficial for your face, because that's not how it would normally work. So a lot of the work we would do as specialist facial therapists is around educating people about the risk of synkinesis and making sure that right from early on they try to prevent some of those risk factors that can make synkinesis worse later on. So I published a piece of research last year that looked at different groups of patients who had specialist facial therapy at different times. And what we found is that the patients who had access to specialist facial therapy early on in their recovery, so within the first 6 months, did a lot better in terms of developing less synkinesis than the patients who didn't have their specialist facial therapy so early. So we think a lot of that is around educating those patients so that they're a little more careful and specific with the way they retrain their facial movement. They don't overuse the face as much, whereas people who don't have access to that specialist education and care are perhaps tending to try to force their face to move. They might have seen some bad advice online. There's a lot of advice out there saying you should try electrical stimulation, or you should go to the mirror and try and force your face to move in different ways. And we know that that can really increase the amount, both those things can really increase the amount of synkinesis that patients develop. So avoiding those detrimental activities early on can give an improved or reduced amount of synkinesis and pseudo-synkinesis later on. But to a certain extent, we can't control the way the nerve recovers specifically. We can control what the way the face moves and the way we retrain the face with the nerve input that it has. We can retrain relaxation, which can avoid sort of overactivity of the face. But so all of these early education, early interventions can help reduce the development of pseudo-synkinesis in particular, but we can't necessarily avoid it altogether. I think that's really important to understand, that if you have had a nerve injury and you have had a slow recovery, then an element of synkinesis is somewhat inevitable. It's not because you've done anything wrong. It's not because you've followed the wrong advice. It's just because that is the way that facial nerves recover. So it's one of those inevitable things. I would also like to say at this point that it's not the worst thing in the world. So I think if we think about synkinesis as overactivity, it still means that you've got activity. Now, some patients don't make any recovery at all. They stay in that flaccid paralysis phase forever. And we can't force a nerve to work that's not working. We can't do that. So the only option for those patients is to go on and have some type of surgery to try and give them a little bit of movement back. But it's never going to be great movement. But for patients with synkinesis, they've got their nerve activity back. Yes, they've got too much nerve activity happening, but it's a lot easier to retrain something and learn to do less than it is to try and have to do more. So I don't think that synkinesis is the massively negative thing that a lot of people believe it to be and really fear it. To me, I think, well, synkinesis, it shows that you've had nerve recovery. It's just that we've got to refine the way those nerves are working, the way the signal is getting between the brain and the muscles. And it's never too late to retrain your brain and to learn new things, unless you have something that actually prevents you learning, like some sort of brain injury, then it would be very difficult to retrain your facial movement. But if you're able to understand and work with your therapist and work on retraining, then there's absolutely no limit to how you can retrain your brain to get the correct signals to the muscles. It won't be perfect. I think it's important, and I'm always very honest with people. If you have synkinesis, we're not going to make your face work exactly the same as it did before. But there's no end to the amount of retraining and refining of the movement that you can do to get your facial movement as good as possible.
You've touched on that topic, but many patients are still curious to know if synkinesis can be cured.
Well, I think I've alluded to this in my previous answer, Veronica, but I think it's good to recap on this. And no, I would say synkinesis can't be cured at this stage medically. So we can't pull out all the new wiring of the facial nerves and untangle it and pop it back into the right places where it was before, because there's thousands of nerve axons or nerve wires going between the brain and the facial muscles. So if they've regrown to different places, we can't cure that necessarily. But that doesn't mean that synkinesis can't improve. So as I said before, if you think about those nerves are going to, let's take that example of the nerve going to the mouth. So some of the nerves recover to the mouth, so the mouth is still working, but some of the nerves that would have previously gone to the mouth now go to the eye. So at the moment, we're in a situation where when the patient moves their mouth, it also moves their eye a little bit. So you could say, well, what are we going to do about that? How are we going to improve that situation? And that's where the retraining comes in. So we want to train that person's brain slowly that when you move the mouth, you want to not move the eye at the same time. And we call that delinking. So we would train people to practice doing small mouth movements, focusing on controlling the eye movements, the synkinetic movements, and gradually retrain the brain so that when they do one movement, they don't do the other one at the same time. Now, that process takes time and a lot of concentration, and we need our patients to be diligent in the work that we're doing with them. But it can certainly improve with practice, definitely. There are lots of other things that happen when patients are synkinetic. So because the face is moving more than it would do normally, because there's this tendency for the face to be overactive, then you can work on retraining relaxation levels, for example. So the face actually remembers to properly switch off when you're asking it to switch off, rather than partially switching off and still holding on a little bit because it's scared to let go completely in case the paralysis comes back, which of course it won't. We can also work on improving the mobility of the muscles that have been overworked so much, because any muscle that you use over and over and over and over again in a way you wouldn't normally use it is going to become stiff and bulky and tight. Imagine those weightlifters in the gym and how muscly they get, and their muscles get really tight and really bulky. Now, our face isn't designed to have stiff, tight, bulky muscles. So if you've got really tight muscles in your face, it becomes hard to actually use them in the normal, gentle, effortless way at all. So some people will think, gosh, I've got no movement in my face, but actually that's only because their face is so tight and stiff that it's not capable of allowing any movement. So even just stretching and massaging the face can make a massive improvement in how gentle people can be with their face, and that in turn can make a massive improvement to their synkinesis. So there's some really great, fairly simple strategies that we can use in specialist facial therapy that can improve the mobility, the relaxation of the face, and give some immediate improvements in synkinesis. And then there's also these longer term strategies in terms of facial movement retraining, refining, delinking, that can give longer term improvements in synkinesis. On top of that, if patients might work really hard in their facial therapy, but get to a point where they say, right, I've made fantastic improvements, but there's still more I want to achieve. So perhaps we can talk a little bit more about some of those other options for synkinesis later on.
Trina, you mentioned a lot of options already. So what are the other options out there for treating synkinesis?
Well, yeah, let's talk about that now then. So as I said already, specialist facial therapy is usually the sort of starting point for synkinesis management. But as I said, patients might work really hard and get to a point where they feel they've got as far as they can with the therapy side and they've made some really great improvements, but there might still be a couple of areas where they're struggling to delink the synkinesis, or the synkinesis is just really quite troublesome for them and might be affecting their confidence, for example. So then we might refer patients to have some botulinum toxin injections. Now, some people will say, botulinum toxin injections, that's something people have for vanity or, for cosmetic reasons. And I don't want to go down that route. But actually, first and foremost, let me reassure everyone that botulinum toxin was first developed and used for treating children with squints. So children with an eye that didn't track correctly, they would be given this botulinum toxin to straighten up their eye and improve their vision. So it's always been a medical treatment first and foremost, and was only used in the cosmetic industry much later on. So it's also used in lots of different dysfunctions. It's used for children with spasticity and so like children with cerebral palsy, for example, to help them use their hand better or to help them walk better. Or people who've had strokes, again, to reduce their spasticity and improve their function. It's used in some bladder dysfunctions when patients have an overactive bladder and incontinence, then botulinum toxin can be used there. So it's used for a whole host of medical issues, and it's really effective for medical problems. So we would refer people for botulinum toxin to try to reduce some of the muscle overactivity that they've got in their face. And the reason that synkinesis can be so problematic for patients is it creates a tug of war in the facial muscles. So if, for example, a patient is trying to smile, well, the smile comes from your cheeks. Your smile comes from your cheeks. And when we smile, the cheeks move slightly up and slightly outwards away from the teeth. Now, if we have synkinesis in some of the muscles that pull the cheek in towards the teeth, like the buccinator muscle, and some of the muscles that pull the corner of the mouth down, like the depressor muscles and the platysma muscle, then that's going to be working in direct opposition to the smile muscle. So you've got one muscle trying to pull up and out and multiple muscles trying to pull in and down. So if we think of that as a tug of war, if we've got one muscle going one way against multiple muscles going the other way, it's a bit like having a tug of war team where you've got children on one side and big strong men on the other side. The children aren't going to have a look in. So to improve the smile, what we have to do is we don't need to strengthen up the smile muscle. In synkinesis, the muscles are working, the nerves are working, but they're blocked by these tug of war of the muscles going in the other direction. So with the botulinum toxin, what we need to do is we need to reduce or turn down the strength of those opposing muscles, the tug of war team that's blocking the movement. So we use the botulinum toxin to actually reduce those synkinetic antagonistic movements. So we might, if we're trying to improve smile, we might inject inside the cheek to stop the buccinator pulling the cheek inwards when we're trying to smile and pull it outwards. We might inject the depressor muscles that are pulling the corner of the mouth down, which are blocking the smile from bringing the corner of the mouth up. And they would all change the balance of the muscles so that the tug of war can go more in the direction of the smile rather than the opposing direction. So botulinum toxin is really useful in that respect, and that's how we would mostly use it for synkinesis. Now, for a few patients, even the botulinum toxin doesn't give them as much relief from discomfort as they might like or need, or they might still be struggling with some of their synkinesis because it was really severe. And in those cases, we now have the option of referring them also for something called selective myoneurectomy surgery. So this is when the surgeons actually go into the patient's face and try to find as many little nerve branches as they can. And they can then stimulate those nerve branches and see, well, which ones are causing purely synkinetic movements and which ones are creating functional movements. And then they can tag those nerve branches and actually cut the ones that are causing purely synkinetic movements. So that's an advance over the last few years that's come about. Prior to that, we had no surgical options for synkinesis. But of course, there's risks involved in having surgery. So it's not something we would encourage patients to go for if they have very mild synkinesis, for example. We'd always say, see how far you can get with a specialist facial therapy, then layer on the botulinum toxin if you need that, and then only have the surgery if you still need further input at that point. But the great thing is there's so many options now for treating synkinesis. And if we work as a team, if we work with the therapists, with the psychological therapists to provide that all-important psychological support to people dealing with facial palsy, and the surgeons to provide the surgical interventions that can also help patients when they need it, then as a team we can really improve the outcome for patients. So it's exciting how much there is out there that can now help people.
Many patients experience the returning of facial palsy after some time. How is it connected with synkinesis?
So that's a really good question, Veronica. So I think there's two things that can happen actually. So when people have flaccid paralysis on one side of their face, and then that side of their face starts to improve and the tone comes back, and then they develop synkinesis and that side of their face gets really, really tight and actually can become more lifted and elevated than the other side. So sometimes people will actually panic and think they've had a facial palsy on the other side of their face, the unaffected side. And they haven't. It's just that the perception is because one side has got so much tighter, the unaffected side can actually look a little bit dropped. So we will sometimes find people saying, oh my goodness, I feel like I've developed a bit of facial palsy on the other side, and they haven't. The unaffected side is still unaffected. It's just that the affected side has become so tight and lifted that it's making the unaffected side look lower. So that's one thing that can happen. I think the other thing you're referring to is this idea that patients go through flaccid paralysis and then paresis and their movement starts to improve and it's really great. They really feel like they're getting good movement. And then the synkinesis kicks in and multiple muscles start working at the same time. And it can look like the movement deteriorates again. Now, when someone's had no movement and then they've got a bit of movement in paresis, and then their movement deteriorates again, their immediate gut feeling is, oh my goodness, I must have got slightly paralyzed again or slightly weaker again because my movement's reduced again. But that's just a lack of understanding about synkinesis. And as I said previously, synkinesis means that multiple muscles are working all at the same time. And when multiple muscles work at the same time, they create a tug of war. So if you're trying to move in one direction, but you've also got muscles pulling in the opposite direction, it's an impossible situation, and it's going to create a reduction in movement, not because muscles aren't working, but because too many muscles are working all at the same time. One example I tend to give to patients is I say to them, you can sit in a chair, and as long as there's nothing wrong with your legs, you can stand up from the chair and then you can sit down again. Now, if I was to push down on your head and then you had to stand up, all of a sudden it would feel harder to stand up, or you might not be able to stand up at all. Now, that doesn't mean that your legs have got weak or that you've suddenly become paralyzed in some way. There's just an external pressure that's stopping you from doing the movement that you're trying to do. And that's exactly how synkinesis works. It's this external pressure. So there's a muscle trying to move one way, muscles also working at the same time that are trying to work in the opposite way, and they just cancel each other out. There's this complete block in terms of what's capable of moving, and it's misperceived as a weakness, which is completely understandable, because when you have the flaccid paralysis or the paresis, the lack of movement at that stage is caused by weakness. The muscles are not back online. The nerve hasn't regrown to the muscles fully. In paresis, it's gradually getting there. So it's completely understandable that when people start to feel like they've had some recovery and then gone backwards, that they feel like it would be paralysis again or weakness again. I completely understand that. And we just need to make sure people understand that's not the problem. We do not need to strengthen up these muscles that are blocked. All right. Making your legs stronger if I'm pushing down on your head won't make it that much easier for you to stand up out of your chair if I'm pushing down hard on your head. In fact, if you try harder, I'll probably just push down harder. And that's exactly what we see in synkinesis. The harder people try and move their face, the harder these other muscles move as well. And they just continue to block the movement. So that's not the answer. We need people to really understand that their face is not moving in synkinesis, not because of weakness, but because of an excess of strength and an excess of activity. So they've got to adjust that and moderate that and retrain their movement rather than just try and force their face to work harder. So that's how this sort of idea of the facial palsy coming back comes about when people are synkinetic. But actually, it's not the facial palsy coming back. It's a completely different process, and it needs to be managed completely differently to weakness. So that's really important that people understand that clearly, and that's where people need to work closely with experienced specialist facial therapists who really understand synkinesis and how it works and how to manage it. And we're educating a lot of facial therapists around the world now, so there's more specialists out there. But even some doctors don't understand synkinesis completely. So I think it's important that patients educate themselves really well. And they may find there's times when they even have to say to a doctor, well, that's not actually how it works. So they can have a role in educating the wider medical community as well, because this is a really complex phenomenon, and it is difficult to understand, and it is difficult to manage. So I think we can all improve the education of the wider medical community by educating our patients, by helping our patients really understand what's going on so that they can then manage it and they can then explain it to other people as well.
Could you offer some practical tips for synkinetic patients to manage their condition at home? Are there specific home treatments or facial retraining you recommend to alleviate the symptoms and improve their quality of life?
Yeah, absolutely. There is loads that synkinetic patients can do to improve their synkinesis. As I said, they might not resolve it completely, but they can improve it massively to a point where It's no longer affecting their confidence. They're able to do everything they did previously. And that's the point we want to get our patients to. We want everyone to feel able to do everything they did prior to having the facial palsy and to feel empowered to live life as they would have done previously with nothing holding them back and nothing distressing them. So in terms, as I've said, the first tip I can give people is not to try and force their face to move in the early part of facial palsy. Find an experienced specialist facial therapist or a facial expert to work with early on, because we know that gives people the best chance of minimizing synkinesis in the long term. But if you haven't got anyone you can work with, at least don't try and force your face to move. Just let your nerve recover. Just rest. Do nothing. You're better off doing nothing in the early stages than trying to force your face to recover and to move. It won't be beneficial for you, and it's more likely to mean you develop more severe synkinesis later on. So that's the first tip I have for people. And as their movement's coming back, don't be tempted to rush to the mirror and see if you can wriggle your nose and see if you can force your eye closed and see if you can squeeze your smile. All of that is just going to cause more overactivity, more of that pseudo-synkinesis I talked about. So don't try and force facial movements. Think about how gentle your facial movements are. Think about how gentle it feels when you move on the unaffected side of your face. And try not to try any harder than that with the affected side of your face. However hard that is, I promise you that will give you the better outcome in the long term. If you can be gentle with your face, that really is the way to go. So when people have developed synkinesis, don't panic. That's what first thing I would say. There's lots of things you can do to help. You really do need to work with someone trained in the management of synkinesis to get the best outcome. So find yourself a specialist facial therapist that can help you. Lots of people can offer online sessions through telemedicine now, so using Zoom or Teams or a variety of online video calls. So wherever you are in the world, you'll be able to find someone working online that will be able to work with you and help you. And they're going to guide you in facial relaxation retraining, in facial stretching to reduce the tightness in your face and therefore make you able to be more comfortable, to move your face more gently again, which again will in turn reduce the synkinesis you're experiencing. And they'll also guide you in retraining correct facial movement, which is complicated. It's not something people have ever had to think about before because your face just moved before you had facial palsy. You didn't have to think about it. So that needs specialist retraining. And also this idea of delinking these tug of war movements, these blocking movements, that needs specialist advice and retraining and practice as well. So they're the specific treatments and retraining I recommend. I don't like to call them exercises because I think, to me, exercise sounds like something that needs effort, something you put effort into, perhaps get a bit sweaty when you do it. And that's definitely not facial retraining. The face is so gentle and effortless to move. You know, we're not trying to exercise it and strengthen it up and make it stronger. We're trying to retrain it. We're trying to make it coordinated. We're trying to make it precise. We're actually trying to make the movements effortless again. So I would call it retraining rather than exercise. But all of these proactive things that people can do are going to improve their symptoms, reduce their synkinesis, and that's going to definitely improve their quality of life, without doubt. And as I said before, if people are really struggling with anxiety or depression, because of their facial palsy, which is really common, and people shouldn't be ashamed to admit that they're struggling with their facial palsy. It's a huge trauma to experience, and accessing support groups, accessing talking therapies, even accessing medications if needed to help them through that difficult phase can be so beneficial and can actually help improve the synkinesis as well, because if you're feeling stressed or anxious or tired or under the weather, your body goes into what we call fight or flight mode. You produce adrenaline. And when you produce adrenaline and go into fight or flight mode, your muscles actually get stiffer and tighter so that you're ready to fight or run away. So adrenaline is kind of something we really don't want happening when people are synkinetic. So actually accessing support, accessing talking therapies, accessing medication if you need it, can be really beneficial in calming your central nervous system, improving your relaxation, and that in turn can improve your synkinesis. So there's so many options patients have, and that's before we even think about the botulinum toxin or the surgery that I mentioned previously. A whole host of things that people can do practically to help themselves to really improve their synkinesis through non-invasive, simple, gentle techniques.
Lastly, Trina, is there any message or advice you'd like to share directly with patients currently struggling with synkinesis?
Yeah, absolutely, Veronica. I think hopefully this has come through already through my answers, but you are not alone. If you are struggling with synkinesis, you're not on your own. There are other people out there who understand how you are feeling and who will be there to support you through support groups, through online chat rooms. And there are also a whole load of us who have devoted our life to specialising in facial palsy, who are working constantly to help people improve their situation with synkinesis. We're passionate about it. That is what we do. And we want to help as many patients as possible improve their situation, improve their synkinesis, get back to living a life full of confidence and joy. That's our mission in life, to really help people. So please don't feel that you're alone. Don't feel that there's no help out there. There really is so much that can be done to help you if you just go out and find people who really understand facial palsy, who really understand synkinesis, and follow their advice diligently. There is so much that can be done to help you. So please don't feel that you're alone. Please don't suffer in silence.
Thank you for your answers, Trina, and thanks for joining us to discuss synkinesis. I want to remind our listeners that they can find even more resources and support in FaceRehab mobile application and on our website, FaceRehab.com, where they can also book online video consultations with facial specialists. Thank you for being with us today, Trina, and for sharing all of your tips and advice.
Thank you so much for having me, Veronica. It's really been a privilege to be able to share this information about synkinesis, and I really feel passionately that everyone who is struggling after facial palsy deserves quality care with people who know what they're talking about, who know how to help them, who can provide that massively important support for them. And if doing these podcasts for you means that I help one more person around the world, then I'm absolutely delighted with that. That is my goal in life, to help as many people with facial palsy as I possibly can. So thank you so much for having me and giving me this opportunity to help people. I really appreciate it.
Facial Palsy. Road to Recovery.
If you enjoyed today's episode, please subscribe to our podcast and leave us a review on your favorite podcast platform. We also invite you to join the Bell's Palsy and Facial Paralysis support group by FaceRehab on Facebook, where you can connect with others who are living with facial palsy and share your experiences. Thank you for joining us today. Until next time, take care of yourself. And remember that you are not alone in your journey to recovery.
FaceRehab. Bring your smile back.